If you're over 50 and you wake up every morning already feeling that tight, achy pull in your lower back, if tying your shoes feels harder than it used to, or if standing up after sitting makes you wince for a few seconds, stop scrolling right now, because this video could genuinely change your daily life. And I don't say that lightly. What if I told you that most low back pain after 50 isn't because your back is weak or damaged, and it's definitely not because you're old? What if the real problem is that you've been doing too much of the wrong stuff, and not enough of just 4 simple movements your body is actually begging for? Stay with me, because by the end of this video you'll know exactly what to do, how to do it safely, and why many surgeons and physical therapists agree these are the only 4 exercises most people over 50 truly need to calm down back pain and start moving confidently again. Let me start by clearing something up, because this alone could save you years of frustration. Your lower back is not meant to do all the work by itself. When we're younger, our hips move freely, our glutes fire properly, our core supports us without us even thinking about it. But over time, especially after 50, we sit more, move less, and start losing connection with those support systems. So your lower back steps in to do a job it was never designed to do alone. That's when pain shows up. Not because something is broken, but because something is overworked. And the beautiful thing is, when you restore the right movements, the back often stops complaining on its own. Now I want you to listen carefully here. I'm not going to give you 20 exercises. I'm not going to tell you to stretch for an hour or go to the gym 6 days a week. In fact, doing more can actually make things worse. These 4 exercises work because they gently wake up the muscles that protect your spine, they restore mobility where you need it, and they do it without compressing your joints or irritating sensitive discs. This is exactly why many spine surgeons recommend movements like these before anything else. Let's talk about the first exercise, and this one might surprise you because it looks almost too simple to matter. But don't underestimate it. This movement teaches your spine how to move again without fear. Imagine lying comfortably on your back, knees bent, feet flat on the floor. No tension. No forcing. From here, you slowly tilt your pelvis so your lower back gently presses into the floor, then slowly release and let there be a small natural arch again. You're not lifting, you're not straining, you're just rocking. This is not about muscle burn. This is about restoring communication between your brain and your spine. For people over 50, this gentle motion helps lubricate the joints in the lower back, reduces stiffness, and sends a powerful signal to your nervous system that movement is safe again. And when your nervous system stops guarding, pain often starts to fade. As you do this, breathe. Inhale as you relax, exhale as you gently press the back down. If you've had back pain for years, this might feel emotional in a strange way because for the first time in a long time, your back isn't bracing. It's moving. That's a big deal. Do this slowly, controlled, for about a minute. Not rushing. This alone can reduce morning stiffness dramatically if done daily. Now, once your spine feels a little calmer, we move to the second exercise, and this one is a game changer for people who've been told they have weak backs. The truth is, most backs aren't weak. They're unsupported. This exercise teaches your core to support your spine without crunches, sit-ups, or anything aggressive. From the same lying position, knees bent, imagine you're gently tightening a belt 1 notch around your waist. Not sucking in hard. Just enough tension to feel stable. From here, slowly lift 1 foot just an inch or 2 off the floor, then place it back down. Then switch sides. That's it. I know it looks basic, but here's why it works. Your deep core muscles, especially the ones surgeons care about, are designed to stabilize, not to flex. When you lift 1 foot at a time, your core has to quietly stabilize your spine without you even thinking about it. No strain. No pressure. Just support. Over time, this takes pressure off the lower back because your spine no longer feels like it's on its own. And if you ever feel pain during this, you're lifting too high or bracing too hard. Keep it subtle. Quiet strength is what we're building here. Now let's talk about the third exercise, and this is where many people over 50 have a big aha moment. Most lower back pain isn't actually coming from the back at all. It's coming from tight hips that refuse to move. When your hips stop moving properly, your lower back picks up the slack. This exercise gently restores hip mobility without stretching aggressively. Get into a hands and knees position, nice and comfortable. From here, slowly sit your hips back toward your heels as far as feels comfortable, then come forward again. No forcing. No pushing through pain. Think of it as giving your hips permission to move again. This movement reduces pressure on the lumbar spine, stretches the muscles around the hips, and teaches your body a safer way to bend. For people who say, "Every time I bend forward, my back hurts," this can be life-changing. Over time, bending becomes less scary, less painful, and much more natural. And I want to pause here for a second because fear plays a massive role in chronic back pain, especially after 50. Many people stop moving because they're afraid of making things worse. But when you stop moving, stiffness increases, muscles weaken, and pain actually becomes louder. These movements are designed to rebuild trust between you and your body. Now the fourth exercise is often the missing link. This is the one that takes the load off your lower back when you stand, walk, or climb stairs. And that muscle is your glutes. Weak or sleepy glutes force the lower back to do more than it should. This exercise gently reactivates them without squats, lunges, or anything that feels intimidating. Lying on your back again, knees bent, feet flat, arms relaxed. From here, gently squeeze your glutes and lift your hips just a few inches off the floor. You're not trying to make a bridge to the ceiling. Just lift enough to feel your hips engage, then slowly lower down. What matters here is control, not height. When your glutes start doing their job again, your lower back finally gets a break. Many surgeons emphasize this because strong glutes reduce shear forces on the spine. Translation: less irritation, less pain, more confidence in movement. Now here's how this all comes together in real life. When you wake up in the morning, instead of bracing yourself for pain, you start with that gentle pelvic rocking. Your spine warms up. Then you wake up your core with those controlled leg lifts. Then you give your hips some freedom. And finally, you remind your glutes how to support you. This entire routine can take under 10 minutes. And done consistently, it can completely change how your back feels throughout the day. I want to be very clear about something. These exercises are not about pushing through pain. Pain is not a badge of honor, especially after 50. If something hurts sharply, you stop. Mild discomfort, stiffness, or stretching sensation is okay. Sharp pain is not. Listen to your body. It's smarter than you think. And let me say this because someone needs to hear it. If you've been told that surgery is your only option, or that your spine is degenerating and there's nothing you can do, that's not the full story. Yes, our spines change with age. That's normal. But pain is not inevitable. Movement, done correctly, is one of the most powerful forms of medicine we have. Many surgeons will tell you they'd rather see patients master movements like these before considering anything invasive. Now imagine this. A few weeks from now, you're getting out of bed without that sharp jolt. You're walking a little taller. You're not constantly thinking about your back. That's what happens when your body feels supported again. Not overnight. Not magically. But steadily. Calmly. Safely. If you've tried everything else and you're tired of being told to just rest or live with it, this approach is different because it works with your body, not against it. And the best part is, you don't need special equipment, a gym membership, or perfect flexibility. You just need consistency and patience. Before we wrap up, I want you to understand one more thing. The goal is not to eliminate every sensation in your back. The goal is to restore confidence in movement. When confidence comes back, pain often fades into the background. And these 4 exercises do exactly that. If this video helped you, do me a favor and let me know in the comments how your back feels right now, or which movement felt the most relieving. And if you know someone over 50 who's been struggling silently with back pain, share this with them. Sometimes the right information at the right time can change everything. Take care of your spine. Move gently. Move often. And remember, your body is not fragile. It's adaptable. And it's never too late to start treating it with the respect it deserves.